Good morning, and thank you for joining us today for a conversation about leading during a pandemic. More specifically, how area nonprofit organizations have gone about reinventing themselves during this period, and which of those changes will be temporary or lasting. Our title for this event is Nonprofit Innovation, COVID and Beyond. Unfortunately, we're having yet to move to the beyond part just yet. Producing and promoting this series of webcast forums takes resources, and we would not be able to bring you this kind of high quality programming without the support of our sponsors, who are Bowditch and Dewey and Middlesex Savings Bank. At Bowditch, their lawyers and staff lead civic, charitable, educational, social, and political projects and activities in the communities in which they live and work. Even through the pandemic, they continue to sit on boards of directors, volunteer their time and enthusiasm to committees and fundraisers, and lent their expertise to nonprofit organizations. They hold leadership roles in scores of nonprofit organizations throughout New England, helping to position those organizations for success. Middlesex Savings Bank established the Middlesex Savings Charitable Foundation in 2000 to help carry out the philanthropic mission of the bank. The foundation has provided more than $13 million in grants to local nonprofit organizations, supporting services and programs in a wide variety of fields, including education and basic human services. Since the inception of the foundation, Middlesex Savings Bank has funded the endowment with over $25 million in contributions. You can find out more about the foundation at middlesexbank.com. So again, thank you to our sponsors, and you can see why these two fine organizations have stepped up to get behind an event about best practices and innovation in our nonprofit sector. Before we jump into the panel discussion, just a couple of quick notes for the audience. If you have a question, please type it into the Q&A box, and we will get to as many of those questions as we can. Today's webcast is also being recorded, and a link to that recording will be sent to you after the event. So now we are pleased to have a great panel and moderator for today's conversation. Our moderator is Samantha McDonald, who is a partner with Bowditch and Dewey. And our distinguished panelists are Grace Elton, the CEO of Tower Hill Botanical Gardens; Deborah Hall, who at the end of June is now the new executive director of the YWCA of Central Massachusetts; Steve Kerrigan, the president and CEO of the Edward M. Kennedy Community Health Center; and Ronald Waddell Jr., the executive director and co-founder of the nonprofit Legendary Legacies. So now I'm going to hand it off to Samantha to run the conversation. Samantha, it's all yours.
Thanks, Peter. Welcome to all of you, and welcome to our panelists. Thank you for joining us today. We don't have a whole lot of time, and we have a whole lot of questions, so I am going to dive right into it without any further ado. I think the question that's on everybody's mind is how did you make it through the pandemic, and where do you see things going? So if you could tell us maybe 2 or 3 changes that you have made that have had the greatest effect on your organization. And Grace, could you start?
Thanks so much, Sam. So as a little background, Tower Hill was closed completely for about 11 weeks, and then we opened on reduced capacity. And this was about a year ago around this time. And my first thought, of course, was, if the doors aren't open, how can I keep my staff employed? We wanted to really avoid large-scale layoffs. And then second, of course, we're a nonprofit, we're mission-driven. How can we continue to connect with our community and provide our services when we can't allow people on the property? So one major thing that we did was switch all of our programming to virtual programming. And I think many other nonprofits did this as well. And that's something that we plan to keep, because we realized that we could reach people from all over the world. We could bring in speakers. For example, we did a couple author talks with an author from England. We got to partner with other organizations and co-sponsor some virtual programming, and we reached many more people than we really do on site sometimes. So we really want to keep something like that. And I think just the nature of our garden is that we could physical distance. We have 170 acres here. So we were really able to still allow, once we were able to open the doors to visitors again, we were allowed to to bring people on site, and they felt very, very safe because they could physically distance from each other. And right before we started the recording, I love the conversation from all the panelists. We were talking about our favorite trees. We were talking about oaks and crab apples and edible landscapes. And it just really shows that plants and landscapes are so important to people. And we found that through the pandemic, that was even brought to the forefront. So we're really happy that we were able to bring people here on a limited basis. And now we're fully open to the public too, because plants really are essential for our health, for our mental health, for physical health. And we're so happy to be providing this service for the community.
Thank you. Full disclosure to everybody, I sit on the board for Tower Hill. So I know a little bit more about how we adapted than I do for the other organizations. And you did a lot of construction work too, as well, right?
We did. We took the opportunity to do both some large scale and small scale construction. When we were closed, we did a lot of minor garden renovations to our existing gardens. And then as soon as we were considered that we could be open to doing large scale construction, we did a couple of major renovation projects. So we renovated our visitor center lobby and the main entrance to our visitor center, removing stairs, making a universally accessible pathway. And this year we were able to launch into about $15 million of capital improvements that we've been planning for upwards of a decade. So we're really excited to be moving forward on that. We're expanding our parking lots. We are building a children's garden, and all of that is with universal accessibility in mind. So everything new that we're doing right now will be ADA accessible, so everyone can use it the same way. We're really excited to welcome new visitors with these gardens.
And kind of an unexpected opportunity to do that all while the garden is closed.
Absolutely.
Or partially closed. Debbie, how about you? Not so much the garden, more the 2 or 3 changes.
Well, we were working on gardens also. We were in the middle of a $24 million renovation project when in March, they said everything shuts down. Luckily, we were given a permit to continue with the construction, and it turned out to be really a blessing in disguise because we didn't have a lot of people in the building. And so construction actually did something none of us expected, but they finished on time. I think it had something to do with the all-women work crew that we had. I don't know, but I think maybe it did. As you know, the YWCA has been around in Worcester, Massachusetts since 1835. We are a trusted institution that is multi-service in nature. And so when we got the call that we had to shut down programming, we all were in a tailspin, and how we got through it one day at a time, I guess, like most everyone else. But we also had some very vulnerable populations that we were working with, like survivors of domestic violence. And as we would soon learn, they were not safest in their homes. And so immediately we thought about that, and we also provide childcare for a number of people, a number of essential workers. And how are we going to do that? So we just put our heads together and started thinking, and we partnered with other community organizations. Thank goodness for United Way. People just came together. We were having meetings trying to figure out how we would serve during this pandemic that none of us had enough information about, and it was really scary. And then we got to work. Our funders, at least our state funders, and a lot of individual givers. People were magnanimous in the beginning. Nobody knew, but they wanted to help. And so that proved very helpful to us in our organization. We were able and had to do something that most nonprofits really don't ever have enough money to do, which is upgrade our technology so that people could work in a remote way and we could stay in contact with our clients, our participants. And that was very important. And then we needed to figure out, I think Grace mentioned this, but also you're wondering what's going to happen to employees. How can you keep them employed? Where is the money coming from? And so luckily, I mean, PPP saved us and a lot of nonprofits, and we were able to keep people working. That was the most important thing. People were scared. What if I lose my job? And we're in the midst of this pandemic. So we were able to do that, and then think about how we would keep employees safe, and then be creative again with other nonprofits in the area about somebody has to work. Where are the children going? So daycare. we can take care, at least on this level, of those people working on the front lines, or nurses or doctors or CNAs. And we're able to provide limited childcare and put in place all of those protocols. None of us, I think all of us now, we talk about PPE like we know. What's an N95? None of us knew that. I think we're all well versed now. And testing, bringing testing to people was so important once it became available. And we've served as an equity vaccine site as things rolled out. So we kind of transformed in that way. We became what we needed to become to sustain while keeping our core values and our mission in mind. We were able to help because it was part of our mission, eliminating racism, empowering women. So that made sense that we would participate in equity vaccine clinics and try to figure out how more people would be able to get tested. So in that way, we kind of veered, but really we kept to our mission. We tried to keep employees safe also as much as we could and keep them reassured, which meant we were having more meetings than we would normally have. And I think, when people talked about being zoomed out now, in the beginning, it was so necessary. And we all became adept at Zoom and DoxyMe and different platforms and trying to figure out how we could best reach people. So those were some of the major changes, just us staying flexible, sticking with our mission, also trying to be helpful to other nonprofits. And the key, I think, particularly in Worcester, but I think I can say this across the country, was that we came together as a community. We came together as nonprofits. We were able to lean on each other. We were able to be innovative and creative and talking to each other and finding out what would work and what wouldn't work. So I think that was really helpful.
Yeah, I know for sure you guys did worked with a couple of other agencies in the childcare, on the emergency childcare stuff, and that's so it was such a necessary thing back in the beginning of middle of last March. When how do you go to work as a nurse or a doctor if you've got no place to leave your kids, or an EMT? So thank you for that. How about you, Steve?
So for us, first, thanks for having me. Thanks, Sam. Thanks, Worcester Business Journal, everybody, for putting this together. I think it's going to be a great conversation. For us, community health centers, our job is to provide access to high quality healthcare, regardless of your ability to pay. Our patient population is more at risk than most patient populations on any non-pandemic day. 90% of our patients are at or below poverty level. 70+% are racial or ethnic minorities. 30% of our patients are totally uninsured. And our job is to be there to help them live healthier lives. And we began planning we were probably the only agency on this, Debbie, that did know what an N95 was, just because we use them a lot, but we had to buy an awful lot more, that's for sure. But we began planning for the pandemic in early February, just from a public health perspective. We weren't planning from a shutdown perspective, but from how could we meet the moment for public health. And I think because we did that, because we had that early focus, we were able to turn on the dime a little bit quicker than other folks in the healthcare industry, particularly in community health. We never laid anybody off. We never shut down one line of business. We were able to pivot to telehealth very quickly, and I thank our elected and appointed officials who allowed us to use telehealth. That's something we've been pushing for years, but we were able to turn on a dime on that because Zoom was not new to us either. We have sites all across Metro West and Central Mass. We've been using a HIPAA compliant version of Zoom for years. So we were better suited to be able to do that. For our behavioral health, for instance, on the 13th, when we realized everything had to close down, they went fully remote within 24 or 48 hours and never stopped providing behavioral health services. And as a matter of fact, provided about 120% of the estimated visits that we had put in our budget and our estimations for the year. Our ability to plan a little earlier and be a little more comfortable in the space of the public health crisis allowed us to pivot a little more than some others in the healthcare space were, which was great. I mean, our focus was, our job is to provide that access, right? If our buildings aren't open, they don't get that access. If our people can't come to work, whether it's virtually or in person, we don't provide that access, which is why we immediately partnered with the Worcester Together group and folks like Debbie's team. Like, the ability to provide childcare was critical, but we knew that wasn't what we did. So we leaned on our great partners like the Y and others to provide that. But our job was to keep our patients healthy, keep them out of the emergency rooms so that the emergency rooms and the hospitals could see COVID focused patients and continue to provide high quality care. And I'm proud to say that we continue to do it. We actually also did use some of our time with less of our space occupied by people to do some capital improvements like Grace did and Debbie did. We did a lot of our work in some of our buildings on floors that weren't being occupied. We did some maintenance there, but it also led us to, and this is probably the beyond part of the COVID and beyond part of the conversation, but we've made some seismic investments in the last few months. We purchased a new building in Worcester that came on the market while we were in the middle of the pandemic. So we purchased that. We're going to be able to almost double our footprint for primary care and other specialty care in the Central Mass region next year as a result of our ability to pivot on that. So we're really proud of the work that we did, but we're most importantly, I am proud that we kept our employees employed, gave them an opportunity to continue to earn a living. We put a lot of our non-clinical staff remote, and they're going to remain remote. Our billing department, we moved into a new office space that was smaller, and they're all going to remain remote, and they've never been more productive. And I think that the pandemic forcing us to think of things differently and through different lenses and with different apertures allowed us to really make some bold choices that we otherwise might not have made in the comfort of pre-pandemic times. But the most important thing that we did in this entire time was continue to provide access to high quality healthcare for our patients, and by the way, be here when this was over. If we went into it reaching out a little too far and doing a little too much, we wouldn't be here when this was over. And our patients needed us the day before the pandemic came, and they need us the day after too, as well as every day in between.
It's kind of the crux of how difficult it is to innovate, right? If you try something really new and it bombs really badly and it's expensive,
yeah.
How do you recover from that? So I think that tends to make a lot of people very conservative about making changes, and therefore sometimes very slow in evolving approaches. But Ron, you have a very different story since your organization just barely had a pre-pandemic existence.
Yeah, thank you. Absolutely. I want to also thank everyone, Worcester Business Journal, and everyone for putting this together. Honored to be here with a distinguished panel. Yeah, we had a very different experience. We were founded in 2018, and please let me set the context for those that may not be familiar with Legendary Legacies. We work with the highest risk young men in the community between 16 and 26. The easiest way for you to understand what that population is to tell you that these are the young men that are most likely to be shot or shoot. And in 2018, we were founded, but it was January 2020 that we got our first significant funding through a partnership with Worcester Community Action Council as a subcontractor to go off on our own. So we had about a month and a half before we were hit with the pandemic, but we were already doing some of the work. One of the things that we were doing in partnership with the Department of Youth Services, as we were running a in-person virtual, in-person studio that we would bring into the detention center, work with the young men to write, record, produce music as they were working through some of their different challenges. And so that brought everything to a halt. But what we did do was I do a little hip hop myself. I can rap a little bit, and I have some people on the team that are singers. And we put together a 3-song EP that we were able to send into the detention center for the young men to listen to. We began to do some virtual work with them because we weren't able to go in and meet with them. We also, we hired more people. The pandemic for us, combined with the increased focus on racial inequality and the lynching of George Floyd, that brought a lot of attention to the work that we were doing. And so we got a support from a number of funders that allowed us to hire more employees during the pandemic. We did engage in some virtual work, but the population that we were working with, the feedback we would get from them in regards to it was, Ron, we're more likely to experience death from our neighborhoods and where we live than from COVID-19. And that's just a very real situation for them. So we continue to provide in-person services with our participants. We were following all the recommended hand washing and sanitizers and PPE. We were doing all those things. And sometimes they were challenging with our participants. but it was something that we knew that they needed for us to do, for us to continue to be there for them and walk alongside them in the midst of this. 95% of our young men are Black and Latino, and the majority of them are at or below the poverty level. And the decrease in services, the decrease in necessary by other organizations that needed to close their doors regarding to the pandemic. Because we were so small, we were a little bit more nimble, and we were able to continue to provide those services. And so while there were partners in the community that were doing a ton of great virtual work, I think what really brought us to the forefront and allowed us to sit at some of the tables with distinguished organizations like the YWCA and Edward and Kennedy was the fact that we were still in the midst or boots on the ground doing that work. And it brought us to a position to be able to come together with United Way and sit at the table with Greater Worcester Community Foundation and the Worcester Together group and talk about what we were doing, what we saw was needed there. And it really helped us grow. We actually were able to, like I said, we went from 2 employees to 5 employees during the pandemic. We went from being able to serve 32 young men to 57 young men during the pandemic. And so those are just a couple of the things that we were able to do.
Thank you. And you did some pretty interesting collaborations too with some organizations. Thinking about food delivery.
Sure. Thank you for that, Sam. One of the big things we did do is we innovated this program. Man, I wish I had more time to tell you the whole story. But what we were able to do was work with the Worcester Housing Authority and the Worcester County Food Bank and a number of food pantries throughout the community to help provide food and resources to the under-resourced communities and our senior communities that weren't able to access, especially at the beginning of the pandemic, when things were very, very, very scary. It was the zombie apocalypse and we weren't going anywhere. And so what we were able to do is innovate a program where we combined that community service aspect of providing those resources with a job training program with our employee job training, soft skill program with our participants and combine those together to be able to work through that with them, receiving funding from the Worcester Together. And that whole piece where allowed us to compensate them and bring them into spaces where they were not typically seen as liabilities, but now seen as assets to the community. And so there were a number of different fronts that we saw that that program and that collaboration really, really support not just our participants, but the greater community as a whole.
Yeah, I think that was really, you say nimble, but I think it was very innovative to look at what are the community's needs that don't necessarily have anything to do with what your mission is, and try to address them. So I think that's pretty cool. What changes do you guys think you will be keeping of the ones that you have made? Steve, what do you think?
So I think first and foremost, it'd have to be telehealth. And that's up to Congress and the legislature, whether or not we can keep it for the long term. There's different gradations of what we're able to keep right now, but we were at behavioral health, for instance. We know we can keep that for the foreseeable future. But we have seen an uptick in people seeing their doctor, whether it's virtually or in person, because we give them that option of what they prefer. Obviously, you need to put a hand on a patient sometimes. But a lot of our patients, you have a doctor's appointment, a physical once a year. You've got to leave your work. You don't get paid time off. You got to find someone to watch your kids. You've got to find a way to get there. So doing the regular check-ins and things, not the physicals, which of course you have to do in person, but the regular check-in stuff, if you can do it virtually on the phone, it shows they're seeing their doctors more and they're remaining healthier, which is critically important to keeping our emergency room diversion up, because the healthier they are, the less likely they are to take up an ER bed. And so telehealth is one we're definitely going to keep. Some remote work for our, we're going to keep as long as we can. Some remote work will remain, hopefully, a big part of who we are, and hopefully some continued growth in the community. But it's I hope, frankly, a lot of the great partnerships that spouted out of the Greater Worcester project and the great work that we've all done, I hope doesn't go away or retreat as much as to pre-pandemic times, because I think we've shown that by working together, not just here in Central Mass, but across Massachusetts and the country, that by working together, we can get an awful lot more done for the patients and people that we care for. So we're probably going to do a little more expanding into areas around the social determinants of health, which are really what we are based on as a community health center, helping people with food insecurity, housing insecurity, job insecurity, stronger education opportunities, things like that. But what we're definitely going to hope to keep is telehealth, because it's been a game changer for how we provide care for our most in need patients.
I certainly hope we get to keep telehealth too.
Yeah,
No childcare problems here, but
yeah.
boy,
I joked with my colleagues at the other health centers when this all started. I said, once our elected and appointed leaders have a telehealth visit, we're going to start keeping on telehealth, because once they see the vast benefit to it, the more likely it is we're going to keep it. So we're hopeful.
Yeah. Okay. How about you, Grace?
Similar to Steve, we're definitely going to keep some of that virtual programming because we can reach people so much farther away from the garden. But we're a garden, we're a site-specific place. If there's something really special about interacting with the plants and being here in person. So one thing that we always struggle with is the weather. We're an outdoor venue. So if we are to plan a big weekend focused on something like, say, botanical tattoos or some of the plant shows that we have, and it's a washout and no one comes, that's a big hit to our revenue projections. So one thing that we've done is planning instead of big event weekends. Now we have programs that are self-guided and that extend over a whole month, for example. So we do still have things like our fall and winter light shows that have multiple opportunities to visit. But this year we also experimented with some really fun exhibits like Yarn Storm, where we had crafters who created yarn exhibits, and there are about 25 of them all over the garden. They were here for a month and a half. So you could come when the weather was good. We weren't reliant as much on the weather, and that's something that we've always struggled with, being an outdoor venue. So we're happy to do more like that. We have one coming up called Wicked Wings that we're really excited about. That'll open September 10th. And there'll be wings all over the garden for a couple months. And you can come and stand in front of your angel wings or Maleficent, for example. These big black wings are really beautiful. So
sounds like some good selfie material.
Oh, yeah, selfie candy.
How about you, Debbie?
Thank you, Sam. And, I would say plants and flowers really helped my mental health during the pandemic. And I know so many people were helped by that, and just outdoor spaces. And we were just talking about the kids and how they're coming back to school now, and employees, and just mental health being real. We're definitely going to keep, and I appreciate the virtual presentations, because we could be anywhere in the world and we could listen to an author, and those things became, and they were free, and most of them, and we were able to chime in, and people were able to learn about different cultures. So Grace, I'm happy to hear that you all will be keeping that. We also will. Our workshops, we had to figure out how to offer workshops to people, and we adapted to a virtual platform, right? So Zoom became a thing. People, as Steve mentioned, for our participants, one of the issues, particularly with survivors that we've had, I've been doing work for 30 some odd years, and what always came up as an obstacle was transportation and childcare. Go figure. And so let's remember, children were, homeschooling, doing remote learning. And so for our participants, a lot of them, it was a relief. They still needed the service. We were able to offer it. They were able to get it through teleadvocacy, and they love it. And it's hard now. We're saying our doors are open. They're like, I prefer to use teleadvocacy. That's about 95% of the folks saying that. And so we are relaying that message to our funder. There was nothing that ever told us we had to see people in person. I think it's not proper. We saw people in person, and so we just kept doing it, right? And I like to say, as nonprofits, particularly YWCA, I mean, we like to think we've always been innovative and done things a little differently, and maybe we thought outside the box or didn't even think about a box, right? Because we knew we had to. But I think it gave all of us another jolt of, hey guys, this is how you started. Most of us started as grassroots organizations helping vulnerable populations. So what happened along the way? We became professionalized, not necessarily a bad thing, but then government funding came in and we started doing things a certain way. And it was nice, if I say that, right now, it was really nice to be at that point again, early in my undergraduate, where you could think like, and you could dream. And as we use reimagine, collaborating, working together. Steve, I'll continue, Ron, Grace, to work with all of you. I think it's a wonderful thing. In that moment, we weren't in competition with each other. We were trying to help each other survive. And it's provided and validated feelings all of us had, which I think is just as important. And so we will keep those things in place. We are currently, Linda did a wonderful job. I was here for 29 years, and here, Debbie, you take it from here. And so it offers us an opportunity also to kind of revisit our personnel manual and have employees involved in that process. I don't need to make up let's have employees involved, because Debbie, we did it from home. So can we continue to do it from home? But what's my answer? I don't know. You did, and you did a great job. In fact, we saw more people than we had ever seen. And that includes our board meetings. Let me say virtually, when you allow people access, right, then the board is happier too. Folks don't have to travel here at 4 o'clock, et cetera. So I think virtual has to me, remain an option moving forward. I don't think we can go back from that. And also just think about the way we interact with our employees, the way our organizations treat employees, and how we listen to employees. And they have some really interesting ideas about how work can happen for them. And as we're trying to retain employees, because there are some employers who are saying, hey, you can, they're advertising that. So I'm like, we have to be competitive. We lose enough people to corporate America as it is. So we as nonprofit leaders need to start thinking about how we keep employees and what's important, and listen to them around that. But definitely the virtual remote work is on the table. All of that is nothing's off the table. Let me say that, to just listen and pay attention and get the work done. That's the most important thing. Let's be helpful to people and get the work done in the most efficient way. So we're really quite open to other things we may find out.
Those board meetings being remote I love them because they are easy, right? But they have some drawbacks. Grace, you want to talk about what you think the drawbacks are and how you might want to address those going forward?
Yeah, we definitely are a site that I think people need to visit to really understand us. So I worry about our board members not coming here regularly and not really understanding our mission, because they're not seeing the Head Start group that's going through the gardens and learning about science. They're not seeing the yoga class in the middle of the gardens. A lot of that is lost without people here on site. So what we're trying to do is still provide that access with the virtual committee and full board meeting access, but then offer tours and incentives for the board members to come and gather as a group. We did a construction tour of our upcoming children's garden, the Ramble, just a few weeks ago, and it was the first time our board had gotten together in a year and a half, and everyone was so thrilled to see each other, and it just, they were amazed at how many people were on site. So they really saw our mission in action, and I do worry about losing that if we're completely virtual or even hybrid. But we have great attendance right now for our committee meetings and our board meetings, as you all were describing as well. So it's hybrid in some way.
Tough thing I think snacks really help, by the way, in-person attendance. How about you, Ron? I don't know how big your board is. Have you been having virtual remote meetings?
We did. We in all areas of the organization, we experienced growth, and even with our board. We, in the midst of the process, we completed a strategic planning with a mini grant from the Greater Worcester Community Foundation in the expert facilitation of Dodie Swope. And out of there, one of our focuses was board development. And so we got to focus on that, to move from a founding board to an actual functioning board that would allow us to continue to grow. And we wouldn't have been able to do that without the virtual platform. So thank you, Deb, for talking about that specifically. That was supportive and necessary for us, not so much with our participants, as I alluded to earlier, but certainly more on the board meeting side. And we were able to grow from 4 to now we have 8, and we're looking at one other board member to bring on to continue to allow us to grow. I think one of the challenges in regards to it, not just the virtual, but what we realized was that our primary referral source was being present in communities where there are high concentrations of poverty and violence. And being in those communities and being able to develop the relationships is what's key for us to be able to work with the young men that we seek out with our organization. So we continue to look at ways to do that. We launched a series of community cookouts, community pop-up cookouts, kind of on the back end when there was less restrictions as things were opened up. It allowed us to just set up a couple grills in those areas and at those courts and really build a sense of community and put our organization and our brand out there first and foremost. And we did it intentionally without any sort of fanfare. It wasn't to not to exclude people that are here, but we wanted the community to know that we were there for them. We didn't want it to be seen as a press release or an opportunity for folks, which is not bad, but we wanted them to feel comfortable and feel like, hey, we're here to learn from you and just be present in your neighborhood and build those relationships. The other thing that we learned, and we also did during this process for us as a newer organization, was we completed our own theory of change and what we want to see happen with our participants. And what that really did was allow us to more specifically articulate who our population is. And so that is really helpful when it comes to talking to our funders, specifically about the length of programming and work that's needed. I think that there's sometimes a misconception that all youth are the same. And those that are caught in violence and a part of the criminal justice system, we tend to look at them as something's wrong with them. But really, there's a lot of underlying trauma. There's a lot of underlying adverse community environments in which they live in that promote some of these things. And so being able to walk alongside and I don't think it's too much to say that what we're working on is actually rewiring their brain and rewiring the way that they respond to stimuli so that they can make better decisions that don't result in negative behavior. And so being able to speak specifically about who our population is and the length of time that it would take, that this population is not going to fit into a 12-week program and have the desired outcomes that we want to see. And so doing this theory of change work is really helped us really identify that it's about 3 to 4 years that we need to walk alongside and work with our participants. It takes 6 to 8 months just to build a relationship enough with them to get past the social distrust that they have because of all the experiences that they've been through. And so being able to articulate that is something that we are clear on now, and we want to be able to keep the Be Legendary program. One of the things we need to do is be able to find ways that funders can still fund that for us. At the peak of it, it was we did get funding to be able to compensate our participants. Some of them have families, and being able to give them 20 hours a week and pay them to provide these services is something that we would need to continue to go forward. And some of that's difficult to be able to communicate. And we're looking at ways to do that, where we don't just have qualitative data, but we can have some quantitative data about what is the impact that it has on our participants to be involved in that type of giving back. So not just the outcomes of who they served, but what does that do to them as they work through understanding what their value is and what kind of impact they have and what agency they can have in these spaces.
That's cool. Thank you. Steve, can you tell us a little bit more about changes that you may have made with working with your board or your volunteers or your donors that you think you will keep, or ones that didn't work?
Sure. So we're lucky. We're lucky for our board every day of the year, but we're really lucky. So the way community health centers are set up, 51% of our board has to be consumers by law. So our board members have been either virtually getting their visits through with their providers or be coming on site to get their healthcare throughout the pandemic, which has been great. It's a huge resource to us to be able to get that direct feedback from our consumers and our patients who happen to be our board members. They've been fantastic, as they always are. We have to meet monthly to meet our federal requirements, and they are almost always all on the call every month. plus on committee meetings along the way, and all of that virtually. I think the virtual component, I'll speak on very quickly, that has really allowed us to expand some of our committee work, because our advancement committee and others were meeting in the morning, and people getting up and driving into our site. That is no longer necessary. Folks can do it with kid drop-offs and a million other things going on. They can do it on the phone or over Zoom. So that, I think, will likely keep. And then how we've worked with our other volunteers and our other funders has been really in looking at them and sharing our vision for how we're tackling the pandemic, but also really how we want to operate as if there is no pandemic happening. We want to be able to continue our operations and the care level that we have, regardless of what's going on with COVID. We know we have to deal with that, but we want to make sure we continue care. And so we've been working in the community to get ideas from folks and finding new and interesting ways to engage. One thing we did, which was we wondered how it would go, but we every year have a walk, typically at our site in Great Brook Valley, that engages the community to get out and stretch their legs. It's a walk, run, 5K. People can walk as much as they'd like or run the 5K. This year we did it out of Polar Park. It was the first ever 5K out of Polar Park. And we had over 400 people register for it in advance. It was one of the biggest community events we've ever done, and raised us a little bit more dough, which was nice, but we charge about $5 to walk, 10 to run. But it was a really good moment for the community to get together in an outdoor space that was really allowed us to separate. We still had over 150 people come from Worcester Housing Authority to the park to participate. So we've used the guise of the pandemic to find new and creative and interesting ways to do the work that we've always been doing, and I think a lot of it's gonna stick behind. And so, but what I'm looking forward to the most is actually having that first. I'm jealous of Grace for having an in-person board meeting, because I haven't laid eyes on some of our board in a while, at least without a mask on. So it'll be nice to get everybody together pretty soon. We've actually bought buildings and renovated spaces since the last time we were all together. So it'll actually be really nice to show them the great progress that we've made firsthand.
Sounds like a great opportunity for a tour for the board.
Exactly. Yes. Yeah. There'll be many tours in our future.
We talked a little bit about collaborations with other organizations, but how do you think have you seen others that you think have had a great impact on our community, or other things that you would like to see change in terms of collaboration? Deb, let's start with you.
I think everybody's at the Worcester Together meeting, to tell you the truth. I don't know. That's a good question, Sam. I think everyone is there, and different people at different times, and definitely different committees. It really allowed us to get to know each other, and like I said, be as collaborative and innovative as we possibly could and can. So again, I hope, like everybody here, that those meetings, those collaborations will continue to happen. With our funders, so, collaborating with funders, we had funders that were extremely understanding, and we had many conversations with them in the beginning. So that was very helpful, and there was a spirit of understanding and giving and being there for each other. So I can't think of additional. I do want to go back just a minute to the board involvement, however, and shout out our board. They're amazing, period, at the end. But we, in the beginning, everyone, again, was having a difficult time. And so our individual donors, funders that we sent a letter. It started with, how are you doing? Are you okay? Pretty much just checking in, wanting to be in touch, but wanting to strike a balance, being in touch, caring about how you're doing, and also saying, hey, we're doing this work and we don't know. We're trying to keep doors open, right? So that was the tricky part, but people, I think most people came to us before we could ever get to them. That's what an amazing community we live in and a country we live in. So it was immediate. The board members became more active. People wanted to know, what can we do? We have an emergency domestic violence shelter, and we have a daycare that stayed open. And what can we do for the employees, Debbie? What can we do? How can we know people are, we really didn't know. I want to say those frontline workers that continue to show, I was scared. So for people to show up to work every day, we just wanted them to know we really appreciate you because you're working with these vulnerable populations that have nowhere else to go. We didn't depopulate, unlike some other emergency shelters. We did not depopulate shelter. So we just kept people in place. And it involved anything from giving plants flowers, sending lunch, sending dinner to employees, writing handwritten notes, just saying we care about you. And also as we, not hopefully on the other end of COVID, other side of COVID, but completely not out of the woods, we continue to think about how the board can be more active, and already active board, but how you can participate in reaching out, particularly to individual donors, because those same individual donors, some of them have taken a major hit also. And so how do we do that? Stay in touch with people, and what will it look like moving forward in terms of raising monies you need to keep your doors open? So I hope to continue to foster those relationships. Again, I knew ED during COVID as of July 1. And so coming on the heels of that iconic leader, Linda, who knew everybody in the community, just getting out there and reaching out to people and maintaining some connection or making those connections is important. So to our private sector, we've been, really, again, wonderful, making sure we keep those doors open and engaging them as much as possible, and partnering with folks. That's what I think will be the focus in this upcoming year.
Thank you. I know that in the beginning, you were talking about donors. In the beginning, there was a lot of focus on safety net, making sure that the safety net was there for everybody. But not everybody's organization is a safety net organization. So have you guys seen a lot of changes in donors? Are you expecting to? Steve, why don't we start with you?
So I would say, first and foremost, the donor population in Central Mass, this is not new. I mean, I was born in Worcester, raised in Lancaster. This is not news to me, but the donor population in Worcester and Central Mass is fantastic and second to none in any community in the country. And they deserve a lot of credit for stepping up in ways that I think they were probably calling all of us, offering us support before we realized we needed that type of support. So they deserve great kudos for that. And honestly, Worcester Business Journal has done a fantastic job of promoting the great work of nonprofits. So you all deserve great credit too. I feel like people, and I have no data for this. I have no data to prove this. So I just want to put that out there right now. I feel like people feel more connected now, which is bizarre, right? Because we are so separated in more ways than we were. But there's this connective tissue that all of us in our communities have now that we didn't have pre-pandemic. And so you see money coming from even smaller dollars, which is fantastic and is really the root of all. To Debbie's point, we all came from the grassroots. That's where all of this starts, right? You see an increase in small dollar donations. We've seen an increase in community-based money. We've seen an increase in big checks too, and we like to keep that coming. But that connective tissue that is the experience we've all been going through and continue to go through has, I think, awakened a lot of folks to the need to be a little bit more part of the community and give, whether it's they remember going to Tower Hill and how great it was for their kids to experience that moment pre-pandemic and during, and wanting to make sure it's still there, or they know someone who was in a shelter or received great support from the YW for childcare, or they know an at-risk youth who Ron's supporting in such a strong way. I mean, they're looking out for ways to be more engaged in their community, and I think it's resulting, at least anecdotally for us, it's resulting in more low dollar engagement, but also community partnership, which I think is the way in which COVID has brought us together as a community and as individuals. If we can find a silver lining in the nightmare that has been the last 18 months of all of our lives, I think that would be it.
I think the community connection part is something we need to keep nourishing and enable it to continue and grow. It's something I think all of the organizations should be thinking about, and I'm sure it's top of the mind for Greater Worcester Community Foundation and United Way as well. We don't have much time left, so I will ask, it's easy to fall back on your routines. And I think that when the pandemic is over, there's going to be some comfort in going back to what we knew and what was safe. But that's not necessarily a great way to grow or innovate. And wondering what you guys as leaders will be doing to try to keep that spark of innovation and risk-taking and outreach to going. Ron, why don't we start with you?
I'm happy you did. We built our organization off values. One of the first things we focused on were our core values, and our core values drive our culture. And so one of our core values is innovation. And so what we promote here is a organization and a culture that really allows for emotional safety, so that you can innovate, you can come up with ideas, and we're unbiasedly, we will explore them and run them through our rubric. And if it makes sense to give them a shot after it's gone through our criteria, and then we'll implement them on a pilot scale. This is something that we know is needed for us. And I hope that other organizations look at it, specifically because the breadth and depth of the complexity of our issues require us to be able to adapt and change quickly. The speed of information, how quickly it moves, we have to be able to understand that sometimes, even me in this position, we have power but not information, and people that have information don't have power. And so we've got to be able to we got to be able to bring those together. And I think that's what a lot happened with the Worcester Together group. And to Steve's point, that's a way you accelerate trust, when you collectively can pursue a goal through arduous tasks together. That's why the military can take guys that never knew each other, and after 8 weeks, they're willing to die for each other. Because they have a shared goal. And so being able to look at that is something that I hope that we can do. The other thing that we'll continue to do, and I would encourage and hope that my colleagues in the nonprofit sector will look at, is how can we stay focused on our mission, but also address other social issues like our Be Legendary program. And so we continue to work specifically with our young men, but we also know there's other social issues that we can involve them and still stay central to our mission and our vision, but also affect other things. And I think that's something that as nonprofits that we should continue to look at, to be able to empower those that we serve and give them the opportunities to be able to share what's needed. And I think that was one of the biggest things that we heard. We're hearing it from everyone here on this panel and other groups that we've been a part of. You hear that we were getting down to the grassroots level, no matter where you were, and listening and knowing what is needed and being able to come up with ways to do that. So it's embedded in our culture to be innovative, and we'll continue to look for ways to have multi-pronged approaches to social issues while staying core to our mission.
Everything is interconnected, and it does make it hard to sometimes stay true to your mission when you can see that there's so much need in so many very different ways, but it all gets connected together. Grace, how about you?
One thing that we learned through the pandemic, we did this a bit before, but it really strengthened the need for this, is listening, both internally and externally. So I got some of the most innovative ideas from the least likely suspects here on my staff. So it doesn't have to come from the director level of each department. I was getting wonderful ideas from every job title, every pay level. And I really want to pay attention to that and make sure that I'm giving all of my employees a voice, even if it's not their specific department, because they all have really wonderful things to add to the conversation. We also started a strategic planning process, a 5-year strategic planning process in the fall right before COVID hit. So we were partway through that process, and it really gave us a chance to start engaging our community. But once a pandemic hit, we we got a whole new perspective of what the community wanted from us and what they expected from us in the next 5 years. So through that process, we engaged over 1,000 people, whether it was through surveys or focus groups or one-on-one interviews. And I was really glad that it was all messages of hope and growth, and really that plants are essential to people's lives, but also that they wanted us to take stronger stances on diversifying our audience and on climate change education and on things that we may have been a little hesitant to really dive into in the past. So I'm really happy that one thing that came out of the strategic planning process is now we have a group called the Community Advisory Committee, and some of your employees probably sit on that committee, because we tried to get representatives from different community groups that we weren't reaching and we weren't listening to. We kept scratching our heads saying, why isn't our audience diverse? Why isn't our workforce diverse? How can we be more welcoming to our community? And we realized it's because we weren't asking our community. So really forming those relationships and going out to community leaders and asking them, how can I engage your constituents? What's a more meaningful way? And it's different for every group. And that's one thing that we were really missing. So I'm glad that the pandemic has caused us to ask more and listen more and not assume so much. So that's something we definitely, it's ingrained in our culture now institutionally.
How about you, Debbie?
Thanks, Sam. I think for sure COVID-19, the pandemic did that, Grace, but also the lynching of George Floyd forced all of us to look at things differently and look at the communities that we were servicing and reaching out and thinking about what we could do better overall. So COVID-19, then you had amplified those disparities, and it was the summer of 2020. They'll talk about it later, I guess. Pardon me, think I'm a lay historian, but it's the summer of 2020. And as a lay historian, I must correct, I aged us by 50 years in the beginning. We're not that old. We're only 135 years old, but something happened in 1835 that was on my mind when I started speaking. So we, not surprising here at YWCA, we live at the intersections of things, right? And so there's a number of things. For us, it will be, staying focused, because we can find ourselves involved in quite a few things, and we'll be launching a strategic plan next year. So I think that's a perfect time to start rethinking and our strategy and where we think we want to go. I told someone, even as YWs, we have different buckets of things we concentrate on, right? But I always remind them we're all pulling from the same well, hopefully. And so our core mission is our core mission, and we all need to be helpful to each other. We have a great group of just employees, a very diverse group of employees that really were activated during the summer of 2020 by a lot of things. And I don't think they'll allow us to go back to just doing the wonderful work we were already doing, but to think about, and some younger folks, younger than me, I'm just about 30 now this year, but younger than me, but they're saying, hey, this is the world we grew up in. This is where we are. And I, reminds me of when, I used to push things a little bit more and say, bring those people, Grace, to the table, because you don't have to be a director. You don't have to be a VP. In fact, I want to hear what the director of facilities has to say. I want to hear those things. How are we serving? I want to hear from the community that we serve. And so we were able during the pandemic, and virtually worked out well, able to do a number of listening sessions around domestic violence survivors. Right? And what are we missing? Are we reaching everyone we should be reaching? And if we're not, what can we do better? So we just completed that survey not too long ago, but we need to listen. Let's remember this moment. And to that extent, again, we'll have focus groups here. We're thinking about surveys, et cetera, but however we can get that information, come back together and think about how we can make work better and how work will look moving forward in the next few years and maybe forever. I see Peter, so I'm going to end my.
I was going to say, so Steve, I'm sorry we didn't get a chance to get
I
to
wasn't trying to close the deal quite like that, Deborah. You can finish your thought. Sorry.
the face popping up. So
I get that you're not going to get to me, Sam, which I appreciate.
Oh, I'm sorry.
No,
Yeah,
it's quite right. No, I do want to make a point that I forgot to mention earlier. Anybody who's watching this, or anybody who belongs to an organization or a company or anything who needs access to COVID-19 vaccine, we have walk-up, no appointment necessary access at our 19 Tacoma Street site. So please tell anybody you know who needs a vaccine, wants information, they can go to our webpage, kennedychc.org, and learn more about it. But please encourage everybody to get vaccinated, and we are glad to provide that vaccine. And by the way, if you run a company or a firm or a nonprofit and you need access to it, we will come to you and provide on-site vaccinations as well. So I just wanted to make sure
Steve,
I got that in. I'm
just here to join the conversation. I want you to be able to finish up, and there's no penalty for us going a couple minutes over. I think it's been a great conversation. So finish up.
I wanted to mention that because the disparities in healthcare delivery are really what created community health centers. We were founded in Freedom Summer. When the Freedom Riders went down to the South, they had healthcare volunteers, two of whom were Dr. Count Gibson and Dr. Jack Geiger, who saw firsthand the inequities in the healthcare delivery in the deep South versus the cities that they came from. And they came back from that summer after sadly bandaging up an awful lot of Freedom Riders, and went to work on creating a healthcare delivery system that sort of looked at those social determinants of health. And that's where the community health centers were born from. So we felt a very real connection in this moment to our history, and to make sure that a need to carry forward on fixing those disparities in healthcare delivery and that inequity. Because oftentimes we're 49 years old. Oftentimes you get a little bit away from you get in your comfort zone, as you said earlier, Sam. Like, it's easy to go back to that. We won't as an organization. We've created, in the wake of the lynching of George Floyd, we created a diversity, equity, and inclusion committee that is staff run. From that, we are creating a career progression tool and different layers within our organization to give people voice and opportunity. And so our theory about radical transparency in the organization is going to continue, and our focus is always going to be on that access and breaking down those disparities in healthcare. So, but I thank you, Peter, for giving me that time to say that. So I yield back.
Well, that's a pretty critical message. So, from my takeaways is from our conversation, and there's so much more we could talk about, but listen to your employees, take some of their ideas into account. Listen to younger people who may still have that burning fire in them that some of us lose as we get older. Do a strategic plan and check on it and keep it close, and stay true to your core values. And then from there, you can innovate and change your organizations and serve more and better and more people in different ways. So thank you all so very much for joining us today. I want to thank the Worcester Business Journal and Middlesex Savings Bank and my own Bowditch and Dewey, and turn it over to Peter.
Yeah, so just a special thanks to you, Samantha, Grace, Debbie, Steve, and Ron for a terrific conversation. I think we all talked about what a strong nonprofit community we have in Central Mass, and it's pretty obvious that that trust you have with funders in the community is based on the strong leadership we have. And you're four of them are with us today, and there's many other leaders in our community that are just doing a great job running these organizations. So thank you. It's interesting, Ron, I know you mentioned innovation as one of your values. I'm looking at those signs behind you. I saw the grind. I'm thinking coffee shop was my first stop, but I don't think that's the grind. I see perseverance. What are the others? Oh, success and persistence. So anyways, all those things sort of come to the fore in our conversation. So thank you all for participating. A great conversation. Again, there's a recording of this if you want to share it with a friend. And special thanks again to Bowditch and Dewey and Middlesex Banks for sponsoring this webcast again. Appreciate it all. Great job.
Thank you. Stay well, stay healthy.
All right.